Hello, you're welcome to the teacher channel, and thank you so much for visiting the channel. If this is your first time, please remember to subscribe, and thank you for that. If you have subscribed already, thank you also. So you can like the video, you can share the video. In this presentation, I want to extend the topic, the subject, the important subject that I started last time on emergency scene management. So if you have not watched that overview, that introductory aspect of this presentation, please do look for the video emergency scene management on this channel and then watch it. So today I want to focus on one aspect of that presentation. Remember that I mentioned the 4 broad stages when the first aider tries to help the patient. Remember that the patient is the person who has need because of emergency. So there are 4 stages. Stage number 1, scene survey. Stage number 2, primary survey. Stage number 3, secondary survey. And stage number 4, ongoing patient care. So today I want to focus on the first stage. So whenever you want to help somebody in emergency, okay, you do it in stages. So first aid is actually a step-by-step way of handling that problem. So emergency scene management is a series of actions the first aider takes when handling emergency. Okay, so in this presentation, I'll focus on scene survey. What is scene survey? What is the essence of scene survey? Why do you do it? What are the objectives of scene survey? Is it important? Do you skip it? Or must you do it? So we're going to find out in the course of this presentation. So scene survey, which is the initial, which is the important first part when you do first aid, the very first thing you do is to check the environment where the emergency has taken place. So you assess the scene for things that could cause harm to you, things that could constitute hazards or danger. So you need to assess the area. The very first thing is to assess the area, because you don't want to be another victim. You don't want to overlook this and then put yourself in harm's way, put yourself in danger by ignoring this all-important stage. It looks simple, but it is very vital. So check up, check down, check around, use all your sense organs, your eyes, your ears, your nose, and do this assessment. It doesn't take time. Okay, look up, look down, look around. Make sure that there is no danger. Okay, your safety is important. Your safety is number 1. So the primary concern is the first aider's personal safety. First aider is the person who is trying to help the person in need. So that person is called first aider. So your personal safety, the first aider's personal safety, is the primary reason why you do scene survey. Another primary concern is the first aider's protection. So the first aider protection is important. Protection is different from safety. They are related, but they are different. Okay, so when we talk about protection, we're talking about all the measures you take against contracting disease or even transmitting disease. For instance, when you put gloves, that is protective. Hand washing is protective and it is encouraged. When you use hand sanitizer, that is protection. When you use pocket mask, when you do CPR or face shield, anything that is going to create a barrier so that the disease will not transmit from point A to B, point C to D, that is protective measure. So it is at this stage that you take care of that. It is at this stage that you assess the need for this for protection. So another thing you do during scene survey is to seek and obtain permission. My name is Peter, my name is Mary, can I help you? So when you say, can I help you, you are seeking permission right there, and it is important. So it is at this stage that you seek permission. So if somebody asks you at what stage do you seek, at what stage do you obtain permission, the answer is scene survey. Okay, this is the preliminary stage. So safety, protection, and obtaining permission are the primary focus of scene survey. Okay, so another important thing that happen at this stage, another important thing that you do is try to answer some of the questions that will naturally pop up in your mind. So whenever you come across emergency, there are questions that will come. Whether you like it or not, there are some questions that will just come up. Nobody is asking those questions. You are asking yourself those questions. Something like, how many patients, okay, are affected? Can you do it alone or do you need help? Are there people around to call upon? So those are some of the natural questions that you try to answer at this stage. Okay, so this stage is important. It is very, very important. It is crucial, vital. You don't skip it. Because if you skip this stage, it means you are ignoring your safety. It means you are ignoring your protection. It means also that you're ignoring that important legal aspect, which is obtaining permission. So this is important. In my next presentation, I will talk about primary survey, which is the second stage. So thank you so much for watching and see you again. Thank you. Bye.